Right now, more than 70% of adults over 60 have high blood pressure, and over half of them don't even know it. In the next 12 minutes, I'm going to show you the 7 warning signs your body sends before things get serious. Miss even one of these, and the consequences can be devastating. High blood pressure, or hypertension, simply means your blood is pushing against your artery walls with too much force. Doctors call it the silent killer, and that word, silent, is the most important thing to understand today, because in the early stages, high blood pressure causes no symptoms at all. None. You can feel completely fine for years, while serious damage is quietly happening inside. Now, why are seniors over 60 especially at risk? Because as we age, our arteries naturally stiffen. Stiffer arteries mean your heart must work harder to push blood through them. That extra effort, day after day, drives pressure higher and higher. Left untreated, high blood pressure is the leading cause of stroke, heart attack, and kidney failure in adults over 60. Those are serious words, but knowledge is protection. Now, warning sign number 5 is one that almost everyone over 60 experiences, and almost everyone wrongly assumes it's harmless. Stay with me, because that one could be the most important. And at the very end of this video, I'll share the single most important number in your blood pressure reading, a number your doctor may never have explained to you. You will want to hear this. Let's begin. Warning sign number 1, waking up with a headache. Not a headache that starts mid-morning, one that is already there, the moment you open your eyes. Here is what is happening in your body. When blood pressure stays high overnight, the blood vessels in your brain experience constant pressure. By morning, that pressure builds into a dull, throbbing ache, usually felt at the back of the head or behind the eyes. Here is the specific pattern to watch for. If you wake up 3 or more mornings a week with a headache, and that headache fades within an hour of getting up, this is not normal. This is your body sending you a signal. Normal headaches get worse when you are up and moving. Blood pressure headaches do the opposite. They ease once you are upright and active. That difference matters. On its own, this is a yellow flag, worth noting, worth monitoring. But if you combine this sign with any other sign on today's list, it becomes a red flag. See your GP this week. Do not wait for your next routine appointment. Warning sign number 2, changes in your vision. This one surprises many seniors because they assume vision changes are simply about age. Sometimes they are, but sometimes they are something more serious. Here's what is happening. High blood pressure damages the tiny blood vessels at the back of your eye, called the retina. When those vessels are under constant pressure, they can leak or swell. What do you notice? Blurred vision, seeing small spots, or moments where your vision goes slightly dark at the edges. Here is the pattern to watch for. If you occasionally see small flashing lights, or your vision goes blurry for a few seconds when you stand up, do not dismiss this as just age. Get your eyes and your blood pressure checked. Both. At the same time. Now, I need to say this clearly. Sudden loss of vision in one eye is a medical emergency. Call 999 in the UK. Call 911 in the USA or Australia. Do not wait. Do not drive yourself. Call immediately. Warning sign number 3. A feeling of pressure or tightness in your chest. When blood pressure is consistently high, your heart works harder to pump against that resistance. Day after day, year after year, the heart muscle gradually thickens, and the result you notice is a feeling of tightness, heaviness, or mild pressure. in the center of your chest. Now, this is an important distinction. This is not the sharp, crushing pain of a heart attack. This is a dull, persistent tightness that comes and goes, especially noticeable after mild activity, like climbing stairs or carrying shopping in from the car. If you feel it only occasionally, mention it at your next GP appointment. If you feel it regularly, do not wait for that appointment. Ring your surgery this week. Tell them about the tightness. Tell them you want your blood pressure checked. Those are the exact words to use. Do not ignore chest tightness. Ever. Warning sign number 4. A pounding, racing, or irregular heartbeat. High blood pressure forces your heart to work overtime. That extra strain can cause the electrical signals in your heart to misfire. Doctors call this an arrhythmia. You feel it as a flutter, a skip, or a sudden, strong thud in your chest. Many seniors describe it exactly like this. My heart suddenly jumped. Or, I felt my heart skip a beat. These are very common descriptions, and they deserve attention. If this happens once, it may be nothing. If it happens more than twice a week, it needs investigating. Tell your doctor. Be specific about how often and what it feels like when it happens. Here is why this matters so much. Arrhythmia, combined with high blood pressure, significantly increases your stroke risk. Those two conditions together are far more dangerous than either one alone. Now, before I get to warning sign number 5, the one I really need you to pay attention to, let me quickly explain something, because understanding this is what makes sign number 5 so alarming and so dangerously easy to miss. Warning sign number 5, unusual fatigue and mental fog. This is the sign that almost every senior dismisses, because tiredness feels normal after 60. Of course it does. Life is full. Bodies need more rest. That is all completely true. But there is a crucial difference between normal tiredness and the specific fatigue caused by high blood pressure. And I want you to understand that difference today. When your arteries are under constant pressure, less oxygen reaches your brain and muscles efficiently. The result, you feel exhausted, even after a full night's sleep. Not just tired, bone tired, and alongside that exhaustion, your thinking feels slower, less sharp, like a fog has settled, and you cannot quite lift it. Here is a simple test. Ask yourself honestly, have you felt consistently tired for more than 2 weeks, without a clear reason? And has anyone, a spouse, a family member, a friend, commented that you seem more forgetful lately? If yes to both, please check your blood pressure this week. Not next month. This week. When fatigue and brain fog appear alongside any other sign on this list, that is a red flag. Please act on it. Warning sign number 6. Nosebleeds that happen without an obvious cause. The blood vessels inside your nose are extremely delicate. When blood pressure is consistently high, those thin vessels can rupture under the pressure, particularly in dry conditions, or during moments of stress or physical effort. Now, one nosebleed is not a crisis. Everyone gets one occasionally. But here is the pattern to look for. If you are having nosebleeds 2 or more times a month, without bumping your nose, and without being in a very dry environment, this is worth investigating. The key word is unexplained. Unexplained nosebleeds, recurring regularly, are your body's way of showing you that pressure is building somewhere it should not be. This is a yellow to red flag, depending on frequency. Mention it at your next GP visit. And if the nosebleeds are heavy, or won't stop after 20 minutes, seek urgent medical attention. And warning sign number 7 is one most people have never heard of. Waking up in the night for no clear reason. Here is what most people don't know. For most healthy adults, blood pressure drops during sleep. Your heart gets a rest. Your body recovers. This is normal and essential. But in many seniors with uncontrolled hypertension, the opposite happens. Blood pressure actually rises during the night. Doctors call this nocturnal hypertension. And it is one of the most dangerous patterns in cardiovascular medicine. Why? Because your heart gets no recovery window. No rest, just constant pressure, even while you sleep. The symptom you notice is waking between 2 and 4 in the morning for no clear reason. Sometimes feeling slightly breathless. Sometimes with a mild headache already forming. Your heart is working overtime and waking you to tell you. This is a red flag. If this sounds familiar, ask your doctor specifically about a 24-hour blood pressure monitor. It is called an ABPM, ambulatory blood pressure monitor. It checks your pressure across a full day and night, and it could reveal something that a standard 10-minute GP appointment simply cannot detect. Earlier, I promised you the single most important number in your blood pressure reading. Here it is. Most people, and many patients, focus entirely on the top number, the systolic pressure, the first number in your reading. And yes, that number matters. But cardiologists now say the number that matters most for adults over 60 is your pulse pressure, and you may never have heard of it. Pulse pressure is simply the difference between your two numbers. Let me give you a clear example. If your reading is 150 over 80, your pulse pressure is 70. You subtract the bottom number from the top. 150 minus 80 equals 70. A healthy pulse pressure sits between 40 and 60. Above 60, and you carry a significantly elevated risk of heart disease and stroke, even if your individual numbers seem acceptable on their own. This matters enormously for seniors, because stiff arteries, which become more common with age, widen that gap. Write that down. 40 to 60, healthy range. Above 60, ask questions. Take that number to your very next appointment and ask your doctor what your pulse pressure means for you specifically. If any of those 7 signs sounded familiar, please do not wait. Make an appointment with your GP or doctor this week. Not because you should panic, but because you now know what to look for, and knowledge only protects you when you act on it. And if this video helped you, I have one simple request. Share it. Share it with your spouse, your sister, your friend, your neighbor. Because the person who needs to see this video might not know to look for it, and that share could genuinely save a life. I'm publishing a brand new video every single day, designed specifically for adults over 60 who want to protect their heart and take control of their blood pressure. Subscribe and hit the bell so you never miss one. I'll see you tomorrow.